Good morning, afternoon or evening everyone, and welcome back to yet another Trollspel edition. Today we are going to talk about the rider's body, and we are going to try and get through find some simple definitions and have a good go at the lower back syndrome, whatever that might be.
Yeah, we start at it at least.
Yep.
Yeah, should we start with the pictures already?
Are you picture ready already?
Yeah, it's going to be about me all the time and all my faults and shortcomings. So, yeah, we can start with picture number 0.
Oh, yeah.
That's me when I was young and when I was absolutely not able to bend in my hip joints.
All right. So what we're looking at here is somebody who can actually, or you have bent your hips ever so slightly, but I would say that you have adjusted for the lack of movement in your hip joint by making 88 new hip joints throughout your back.
Especially a large one exactly where my shorts stop, like in the waist.
Yeah, great.
Yeah.
That doesn't make life easier, does it?
It looks very strange.
It looks a little bit weird.
I didn't know then that this was really strange. But quite early, when I was like 19 or something, I started getting pain in my lower back. Mm-hmm. And nobody knew why. And they were the physiotherapists. They were trying to find out. They measured my legs and found out that one of my legs were shorter than the other. So I got like this extra sole that I could put into my shoes and stuff.
Yep.
It didn't help, but that was not the problem. But
the foot wasn't the problem when your lower back was the problem? That's weird.
Yeah, but the problem is in the neck.
Fair enough.
So the problem was not in the lower back. But if we let's look at picture number 4. That's quite a new picture when I actually have learned where my hip joint is. There.
Right. So we can obviously see a difference. This is training by doing kitchen stuff, making bread or something.
Yeah, bread, I think.
So what we can see is that the back is straight.
Yeah.
And there is obviously a hip joint back there somewhere. So the hip joint is located where the femur attaches to the pelvis.
Yeah. So in between the thigh and the upper body, there is a big joint. And the hip joint is often when we have clinics, I ask people, can you point to your hip joint? Mm-hmm. And they're pointing at all kinds of other places. And many people they don't move through the hip joint. And you can see that when many people are riding, the hip joint does not move, but the waist is moving.
Yeah.
And I had that problem. The first time you saw me riding, you said, you can't sit like that. And I said, what do you know about that? You can't ride. Because you had never ridden.
Nope.
But you knew something about
I knew that back was
posture.
not going to be a good idea.
Yeah, and you were right.
Yeah.
You're right. I had really a lot of pain in my back all the time, and I couldn't almost not walk when I got off the horse.
Yep. I remember you had to use crutches sometimes.
Mm-hmm. And it has been better, but I've got more children. I've got like all kinds of things that have happened to me after that as well. Mm-hmm. So it takes time, but we know that you guys, all people who are listening, and lots of our students, they have broken their backs, and they have, there are so many things that have happened to them. So we have all things that we are struggling with.
Yeah, and even if we're not struggling, the principles we are going to lay out will, as well as when we talk about horses, it will be the same idea here, that when you apply these principles to your movements or your training, it'll improve you whether you have a problem or whether you are aiming for the very top.
Yes, and we this last 3 weeks, as many of you might know, we have been training lots of stunt riders, and those are really athletic. But
Quite.
even several of those have
Wobbly midsections.
Yeah, wobbly midsections and not enough action through the hip joint.
Yeah.
And they have had a lot of benefit from the kind of training that we're going to show today.
Yes, quite interesting actually. When we debriefed the whole thing, we asked what they thought they had learned, and there was one person said that she had understood that sometimes her body does things that she hadn't noticed that it was doing. So she thought she was doing one thing, and then after being told and then shown in videos and stuff, she could find out that she actually didn't do what she thought she was doing. And that is one of the first things that we have to address when we teach. Always, if you want to affect some sort of change in movement, the first thing you have to do, simplified, is ask, can you move like this instead? That is very simplified, and of course there's a billion things that will go wrong in that equation, but still that's one of the main things they had learned, was that they had understood that sometimes their bodies didn't do what they thought.
And then they were not so good at jumping as the others, for instance.
Could be.
Some of the athletes that were not that good at jumping onto the horse, they had this syndrome.
Yeah. So when we say lower back pain syndrome, it doesn't. Of course, that means pain, obviously, but you don't have to have pain for this to be an issue. So the issue isn't that when you get 40 or 60 years old or whatever, your back is going to go numb and you're going to die. The thing is that we are searching for two things. If you need help with something that's painful, that's one thing that this might help. And there is another thing too, and that is we are looking for all the capacity you actually have in your abilities to move that aren't realized because you don't know exactly how to move through hips and how to stabilize your back.
And this is especially good for like sitting to the trot and sitting to the canter in a good and supple seat.
Yep.
And also sitting to a horse with big movement. It's necessary to do that with a supple hip and a stable upper body.
Helps for jousting too.
Yeah, very much. So we're going to talk about that later, about the stable body and the supple hips and shoulders.
Yep.
But let's look at a couple of pictures of me again. Let's look at picture number 1.
Me.
This is how I usually. This is how my body wants to stand.
Yeah.
And when I stand like this, I feel really comfortable. This is my comfort zone. And it ends up with pain in my neck and pain and migraines and pain in my lower back and everything. But it's very comfortable to stand like that. I walk like that when I don't concentrate. And this blue line is sort of where my diaphragm is, where the muscle that you're using to breathe.
Kind of mushroom looking thing attached all the way down through your spine and then mushrooming up into your rib cage.
Pulling your lungs down, but you see the arrow, the red arrow. When you breathe down there, you're not breathing down in your stomach. You're breathing like outwards, forwards into your forward stomach. Yeah. It's difficult to explain, but let's see the other one. That is the number 2.
Picture number 2.
This is the same at the same time, and it looks like another person.
Yeah.
This was after Pelle had said to me, Shoulders back, head up. No.
Tweaked everything around.
You said
not like that and not like
very
this, and
many
that's very
times.
wrong. And you should do this more, and this less, and this more, and this more.
And this looks very comfortable. It was painful. It was really terrible to stand there. I look happy. That is because my face comes into a different position, so everything looks more relaxed.
Yep.
But
it's not easy.
And I couldn't walk. It was impossible to walk. But this is a long time ago.
And that's a good thing because you were standing on a table, if I'm not mistaken.
No.
Aren't you? Are you sure?
Yeah.
I thought maybe I put you on a table and adjusted you up there.
Yeah, maybe.
Funny anyway.
But you can see what's the orange arrows indicate that when you're breathing, then you're breathing downwards into your abdomen so that your belly and your lower back goes out at the same time.
So you expand all the way around.
Yeah, and then
right.
I've been doing training for this like for 20 years because it's been taken a very long time to find out where the problem actually was, and it was in the neck. Then I can feel now that if I'm able to breathe like that, I'm able to stabilize so I don't get any pain in my lower back.
Yeah.
So, and I know that many people have the same problem in the neck, but there might be other problems that, many women have the same problem and they get it when they come into adolescence. Say that again. Yeah. When they become teenagers.
Smart.
Yeah. Because then the pelvis becomes wider.
Yeah.
And then and also, you still have the narrow waist. So when you get this, women, girls in that age, they start like the pelvis is doing like this. They wiggle when they walk. Yeah. And it's supposed to be very feminine, but it's also it's not very good for your lower back because it doesn't stabilize, and it's not good for your riding. Because when the horse wiggles, you wiggle and you can't help the horse to stabilize. So we're going to talk a lot about that because I would say like more than 60% of the women that we teach have this problem, more or less. And many of them haven't got any pain in their back yet, but they might get pain in their backs.
It doesn't really matter. The point isn't pain or no pain. Mm-hmm. The point is
efficiency, function. Yeah, and a good seat and good riding.
Yeah.
Yeah.
Or good running, good lifting.
Good everything. I wonder, should we... Yeah, I want to watch 2 videos first that are not about riding.
Right.
And that first, I want to see the 8942 video, if I can see that, because it's Pelle jumping and squatting. Yeah, I can't do this. Let me see several times. Can you see that he's jumping through the hip joint?
Only thing I can see is that my butt jiggles. Arnold Schwarzenegger says that if it jiggles, it's fat.
Yeah, but
All right, let's look at the movement.
Now let's look at me then. I'm trying. Now the interesting thing also is that you have your heels are in the ground all the time.
Yeah, when I kick off.
Kick off from your heels.
Yeah.
Many people, and I used to have problems with sitting down and squatting, sitting down like that.
Yeah.
Without lifting my heels up.
Yeah. Can you stop it at the bottom? Is that possible, Emma?
You're too quick, Pelle.
Yeah.
But I have another one. I have a picture of
fine.
myself.
It doesn't matter. It's fine. A picture?
Yeah, I have a picture of myself. I think it is The number three, I think. Let's do picture number 3.
Yeah. Yeah, just run that
Here.
instead. All right. Wow.
I've been training a lot to get there.
Yeah. So heels on the ground, I think.
Mm-hmm.
Kind of hard to see in the shade, but I'll trust you on that.
Uh-huh.
Knees out a lot. Can you? Why? Why do you keep your knees out like that?
Or else I will just fall backwards.
What does that? Why? Can you just keep
Huh?
expanding on that?
Yeah, I think I have a good room. I think I'm too fat for it or something, because our kids can do that with their legs straight forwards.
Mm. Yeah, but then they will round their backs.
Ah, perhaps, yeah.
So there is for most all people have slightly different attachments of the femur in the pelvis. So it's kind of I think I can show this. If we call this the pelvis, and this is your there we go. That is your what do you call that?
Trochanter.
The trochanter and the femur down there. So so all that is your leg, and that is kind of plugged into the pelvis like this. So that means that the femur can move around in many different directions from there. But there is the femur looks or the pelvis has a different look than that. So at some point the bone is going to hit into bone somewhere and then start moving your pelvis out of its position. Mm-hmm. So when you close the joints, the bone starts moving the other bone, right? Yeah. There is a maximal maximal movement range in the joint, but you are not allowed to believe that you have reached this. Okay, the two of you who have, that's fine, but no, there's not that many. No, none of you. That's a joke. But most of us, we never ever get near the maximal range of the joint itself. Most of the time we struggle with stiff musculature, and if the musculature isn't stiff, then sure as anything the hip capsule, the joint capsule will be stiff.
What is the joint capsule? You must explain.
All right, so where the bone pops into the hip like that, there's a capsule there. We call it a capsule.
And it's not just bone.
No, it's not bone. No, it's not bone. It's made out of ligaments. And those ligaments are just the same as the ligaments in your knee, for instance. And they are there to hold the leg into that position. And it is so tightly fit that when you do operations and replace that, they use a small sledgehammer to pop that back into place. And that's after you've cut away all the muscle. So it's really tight.
Let's talk about something else.
You can't get your hip joint out of there without being hit by a truck or a horse, maybe, if you're really.
But
really
the hip joint can become very stiff.
Yep. Yes, the hip joints can be very stiff. Most of the time they are stiff due to lack of training in the right movements. So let's say, like we said, the kids or a 2-year-olds will happily sit all day long in their deepest squat.
In that position.
Oh yeah. No problem whatsoever. And they can sit there for us. And then we stop doing it.
We sit on these chairs.
Sit on a chair instead. That limits you to 90 degrees at the hip and 90 degrees at the knee, more or less, and with no weight carry. So and also you sit on your musculature, so the musculature goes it becomes less active. So the neurotransmission is worse, and also the blood flow is worse. So sitting here is bad for us. But the whole point here is that what we were getting at was that you sit with your knees out because you need some room in your hip joints. And this we can see quite often when you sit on the horse as well. If you can manage to keep your pelvis in the correct position, so square right up and down, Most people will tilt the pelvis too much forward. Very few, and mostly males, will tilt it back. So the top of the pelvis leans back, while most women tend to tilt it forwards, and many men as well. But when you get that in the correct position, the stiffness around the hip joints will pull the legs out of alignment, so that you can't get your legs back underneath you. And the only way to cheat it into the right position again is to allow the knee to rotate out. And this isn't favorable. This isn't the best idea. But we have to get the pelvis in the right alignment. So we allow the knee to come out. And then when you have become really, really flexible, the whole leg can roll back in and your knees will point forward again.
Because the most important thing is to get the pelvis in the right position.
Yeah, why is that?
Because that is a building block for the whole structure.
Is it?
Yeah, because you're sitting on your bum in the saddle, and then this block is the pelvis, and there is the waist and the upper torso, and the head on top of that, and you have to build from. Yeah.
Built like that.
Yeah, and if the pelvis is like this and then
the spine will kind of try and.
Yeah, and that is you saw on my picture.
Yeah.
You can see that it was not put.
Can we look at that again? The first picture, the 0 one?
No. Oh yeah, the one when I was in the boat.
Yeah, it's important.
Yeah.
So that wouldn't be a good riding seat, I believe.
No, and not a good two-point seat. No.
No. And that's because there is nothing here telling the knees or the hips that they have to do anything. Everything here happens in the back.
Yeah.
So you can see that all the if you imagine the spine in there, it kind of bends slowly all the way. So you have the pelvis is sort of straight up and down. There we go. And then the whole back just rolls away or bends a little bit all the time like that.
So it seems as if I wanted to do anything, move or anything, my pelvis would be in the same position all the time, and it's just the back that changes.
Flops around.
Yeah.
And that is very much what you did. I remember that when we met, your the musculature in your lumbar region, so the lower back region, was extremely well developed, but there was no ass.
No, nothing. And I have been struggling with developing seat muscles for many years now, and be constantly sore. Yeah. But if we look at picture number 1 again, where here you can see that the pelvis is. Yeah. The pelvis is. Oh, let's see. Yeah. The pelvis is like this.
It's tilted forward, right?
Yeah.
So
I have to find out how to do this in. Yeah. Yeah. You can
so
see,
the top of the pelvis is tilted forward.
Yes, and then the sort of the spine is going backwards again, and then you have this sort of hunchback. Yeah. And then the neck is forwards. Yeah. And this is not a healthy building structure. No. Because if the horse is starting to move, the whole thing will wobble. Yeah. And I know that because this is that is why my biggest problem. Yeah. And then you can't have your hands still, and your legs are gonna flop. So you need to get your pelvis sitting straight and your hip joints relaxed. If it wobbles, it's slack. Yes. So and we can talk more about the Stamo principles as well, but perhaps we should watch some videos first. Let's watch some video. Or else people will fall asleep from all the talking. So are we gonna ride now? Yeah, let's say 5577. That is the first one, and then I'm actually gonna show the sway back thing. Good. Yeah, the first thing I'm doing then, I'm sitting on my. Yeah, you see? Crotch, I think the word crotch. Is. And then very sway back. And whenever I'm saying, people said to me, straighten up, you have to straighten your back, I was swaying more. Yeah, I remember that. So this is, now I'm showing the exercise that is very good for straightening your pelvis. You see, I'm tucking my bum onto myself while I'm sitting like that. And then I'll take my legs back again, and then it's stretching a lot on the inside of the thigh and the front of the thigh, like there.
Yeah.
But now you can see that my back is straighter.
Yeah. A lot
And
straighter.
I'm feeling that my legs are too stiff, and then I'm doing this exercise to engage my hip joint. And it's difficult for me because
engage your hip joint.
Let's see now. When I hold there, I push my hip joint forwards. Can you see that?
Yeah, all right. Yeah, I saw it when it fell back, sort of.
Because it was difficult in the beginning to get hold of get in contact with the muscle.
Yeah.
Let's try to see it once more, because this is important. If we can see the close-up.
Oh, the super sway back. Oh, don't do it. It hurts my eyes.
I can't do this while the horse is moving because it's so painful.
Yeah.
And then you see, I get this big bum, the big tummy, belly sticking out, so it's not a good thing. It doesn't look nice either. But you can see there, I'm just, and then now it's straight. It's very easy to do it in this way, but you need to take your legs away.
So put the legs on top of the knee pads, and then pull your butt forwards. Mm-hmm. It's important then to lift your crotch as high as you can, or high at least, so you don't sit there and crush your crotch on the front of the saddle, because that's really
painful for both sexes.
Definitely.
So this trick is very nice if you feel that you're too stiff in the front of your thigh, because it is different when you get your bum underneath you and straighten up the pelvis. It's often very you get sore on the front of your thigh.
Yeah, absolutely.
Because the hip flexors, the muscles who are closing the hip joint,
Yeah.
they are too short.
Yeah.
So they will sort of try to drag your pelvis forwards again.
Yeah. So this is now we get into what muscles then, and where does it, and where should it stretch, and what should I... There's 1,018 billion different ways of feeling the pain of stretching the front of your thigh, or as it is, opening the hip joint muscularly. So what Hanne showed now is to take care of some of the muscles. And these particular muscles that she's trying to stretch a bit are the quadriceps.
And the psoas.
And yeah, it's extremely difficult to get a hold of the psoas in that, but it's in that particular movement. But it can be done, but then it becomes a skill thing.
Yeah, but but that exercise that I showed is helping a little also.
Yes, it does, a bit, but it is still a skill thing. Mm-hmm. Right, so we have to think about, if you think about if that is your knee, then all the muscles from the knee up to your hip joint on the front, all of those might need to stretch and become longer. Mm-hmm. And it'll hurt somewhere along that line, depending on where you are stiffer.
And I promise that we are going to talk a lot more about this in the future streams. And the specific things that you can do to stretch different muscles, different joints. Mm-hmm. We're not going to be talking about these theoretical things for all the streams. We're going to have some writing as well.
Yes, and we will also have some training in the training rooms.
Yes. So, but let's try the next video. It's 5578. Then I think here is another exercise. I'm closing my hips and then I'm rising again. And this is a very good coordination movement. And I've been doing that with very athletic riders as well. Mm-hmm. And then I sat back and found my seat again. You see, this is often very difficult for people. And the surprising thing is you need to use your abs muscles a lot.
Very strange.
Because you need to stabilize the upper body to get the seat muscles to do the whole thing.
Mhm.
So, but then if you get hold of your abs muscles and stabilize there, you can get the hamstrings and the seat muscles to do that job. And if you do that, you get a better balance between the muscles on the front of your thigh and on the back of your thigh.
Yeah.
And then it's easier to also do the sitting trot and the sitting canter.
Yeah. Absolutely.
So, yeah.
So this teaches you to use some of the muscles you should be better at using.
Yeah.
It teaches you to use the butt a little bit, and it teaches you to use the hamstrings a little bit, and the lower back is in it, of course. But it is all of that is weighed against the abs.
So the way to stop overusing your back muscles so that they get painful,
And the psoas.
yeah, is to use your abs muscles and your seat muscles and your hamstrings.
Yeah.
So, but you need to wake them up.
Yeah.
And these are different exercises to help you do that.
Yeah. And specific exercises for doing that on horseback. Because on horseback is a very extreme position to be in, like we have talked about earlier.
Yeah.
Because you sit there with your legs so bloody far apart, it's really, really difficult to get yourself into a good position. And then once in that good position, you're sort of unable to move.
Yeah, because there is a horse in the way.
Yeah, it's
Yeah.
really, really difficult to engage the right things. I think a lot of it actually comes down to all the teaching or all the learning we have done at just sitting on our chairs. So what you do when you sit down on a chair is just turn everything off.
Yeah.
And then that means that whenever you sit down, everything turns off, right? The muscles are like obedient dogs. They do what they do most. That's what they will always do.
Yeah.
So if you've turned them off a billion times, well, then you have turned them off a billion times.
I think the only muscle who is actually trying to stabilize you when you're sitting like this is the psoas.
Yep.
So it gets too short and too hard.
And then it becomes very interesting with some of the old texts that say the rider's seat should be half seated, half standing.
And you guys, whenever there is a strange muscle name, look it up on Google and you will learn more. And let's look at next video. It's 5579. There is more about the forwards leaning, like 2-point seat-ish riding.
All right.
It's a way to get into the 2-point seat. You do the same, and you're just leaning forward with your upper body from the hip joint until your bum is out of the seat.
You did a little bit better here than you did in the previous.
Because it helps to practice.
Mhm.
Because
So-
my body does not want to do this.
No,
It's got really trouble with it.
Yeah. So, and I think that what I can see here is that you are the ratio between how much you move in your hips and how much you move in your lower back is better in this one. That's interesting to see.
Because so I should every time I start riding, I should do this as a warm up.
Yeah. I used to do a lot of lunges on the ground. I've stopped doing those again. I'm gonna have to start it up, I guess. So that's the hip joint she's pointing at there.
And you can see I'm trying to show how you can move. And you have to move, when the horse is moving, you have to move in the hip joint, in the knee joint, and in the ankle. And the rest of the chain, the
How
upper
about-
body needs to be straight and quite stable.
All right. Yep.
Yeah, there I'm showing how most people, I usually say to people, can you stand in the stirrup? And they are trying to stand straight up as they do when they're on the ground.
Yep.
But you need to feel like that you're actually just leaning forward with your upper body until you have all your weight in the stirrups.
Yep. If you don't lean, then you will either have to keep your
Look
legs
at that.
way too far back. That is a possibility. or you will have to push your legs out in order to stand up. That is possible on the ground, but there is no friction.
The stirrups are wobbly.
Yeah.
Yeah.
The stirrups are a little bit like what they call a zero friction surface. So there is a little bit because they move up in all directions other than...
It's just like Iron Man when he's standing on his rockets.
Rocket boots. Yeah. A student of ours thought he learned that way. I was trying to explain how you should keep some of your balance in your feet. And I had a stupid way of explaining, like, because what I thought when I tried to, the first times I actually managed to do that, I felt like I was like standing on two water fountains, like balancing on two different water fountains like that. And I'm like, and then that made me do the right thing. And I was trying to explain that, and this guy says, "Oh, it's like Iron Man's boots," which is a much better metaphor.
Yeah.
If you've seen Iron Man. If not, homework. Very easy homework normally on this show.
So in the next video, that is 5580, I am showing how it is to be very wobbly when your pelvis is not like
aligned,
perpendicular.
Let's look at wobbly.
Now I'm trying to sit like really stable in my core.
Yeah.
Just concentrating on core, and let the hip joints just be loose. I am not very good at being loose in my hip joints, as we know. So it looks a little stiff.
Yep.
But it's better to start with, can you see now that I'm, yeah.
Oh, stop. No, don't stop it.
And look at the horse. He doesn't like it at all. And now I lifted myself up and I sat down with my pelvis straight, and everything looks better again. It looks more stiff, but it's better to sit there and be a little stiff and then try to become looser in your hip joint. And now perhaps it's time to talk about stab mo.
Stab mo.
Yeah.
Yeah.
You know,
this is a really cool little way of expressing things that a guy that we've been following for a long time, he calls it stab mo. It's the relationship between how mobile you are in your shoulders and in your hips, as compared to how able you are to stabilize your spine. Because the body demands that there needs to be some stability somewhere. So, for instance, if you're sitting on the horse, then most people, like, if you have never ridden, most people will try to hold on with their legs, like really squeeze their legs onto the horse somehow. If it's just the knees or just the upper thigh, or it doesn't really matter, pulling your heels up. Who hasn't seen a rider pulling their heels up, right? Keep your heels down when you're riding, that's important, right? This is the reason. It means that you're holding on to the horse with your legs. And if you are, then your body has to have movement somewhere, so your upper body will be all wobbly and your spine will be completely unstable. So we have to switch that around, because what we just described isn't balancing.
No. And also this thing that you said, that if the spine is stable, then the shoulders and the hips can be mobile.
Yeah.
But that goes the other way around as well. So if the spine is not stable, the hip joints cannot move.
Yeah. And there are even more variables in this. It's really horrible. So if your spine isn't mobile, then your hips and joints can't move either.
All right.
Yeah. So if you see, since we're using you as example today, we know that one of the problems for you, can I point, have been these muscles are extremely tight. And that means that the spine cannot move in that area.
Can we show?
So it blocks the whole spine in this region. So if we look at that, these muscles down, very good, Ivar, thank you, there. These muscles cross up here and attach on the back here somewhere. And that means that if they are stiff and short, they pull the head this way. And they want the head to be stuck here, and that makes this crease here. So there's a little bit of a bump on the neck here. So it comes, yeah, you see that bump? That's not that fat. Means that
it's the spine.
Yes, that means that the spine right here can't straighten out. And if that can't straighten out, that means it's not flexible enough in that particular area. And that means that the shoulders can't do their job. And it also transfers down through the spine, so your lower back can't do its job, and then that means that your hip joints can't do their job. And also there's a mute function there. So when the neck is like really bent forward in that area and then bent back up towards the head, then the last few joints up towards the head will be extremely flexible. And that extreme flexibility doesn't allow for power to be transferred through. So anything that Hanne's body thinks, or the brain experiences, that some power is coming up through the spine, that can't be allowed. It has to end before it gets to here.
So it's impossible for me to jump.
That's why you can't jump.
Because my body won't do it, because then I will hurt my neck.
Yeah, or at least that's what the body thinks, and it's probably fairly right.
Yeah.
But quite sometimes things have happened to your body that the body has healed, but the pattern still stays there. And to find out which of these have actually happened is one of the things that you need hands-on and experience to do. So that's why you can't just say, everybody needs to do this, because that's not true. But we need to make sure that the spine is mobile and you are able to stabilize it.
Spine is mobile so that you
can get it into the correct position, which is the exact same thing we do with the horses. You can't just take any horse and shorten the reins and pull it in, because it'll get shortened the wrong way. It won't straighten up and become the right.
That's why we have to stretch the horse out before we collect him.
If you can't straighten the horse out, that means there lacks some flexibility along some points around the spine.
Shall we look at the wobbly me again?
Look at the wobbly her in the lights of what we have talked about again. 5580.
That's
so this is
me.
Stabilized Hanne.
And you can see a certain movement in the hip joint.
A little bit.
Yeah.
I would say about as much as in the spine. Hey.
Evil you. Yeah, you're right.
Yes.
And now I'm starting to pull my bum backwards and sit on the crotch.
Oh, God.
Look at that.
And the rhythm goes straight to hell in a handbasket. It looks absolutely horrible. Don't do it.
And imagine if we do this in trot, and I can't show you that in trot, because then I get so much pain in my back, I can't do it. But I did that before, and that's the reason why I have this trouble. Yeah. That's the reason why Pele said, "Why are you sitting like that? It looks awful, and you must destroy yourself." And
so
I did.
a few.
But the funny thing is that no riding teachers told me that this was wrong.
No. But this was way back.
20 years?
20 years ago now.
Yeah.
And there wasn't a lot of focus on how the rider should move. The rider's movement was sort of viewed as like the topping on the cake at the very end.
Yeah. And
now you can learn how to sit properly, because you know how to ride. And I'm like, but isn't that the same?
No, the seat is the tool to ride well.
That's what I thought.
Yeah. So, but let's see how I train sitting trot. That's 5581, and then you could train even though you have this trouble and it's difficult. Then you're easily sort of pushed out of the position by the horse when the horse moves.
Yeah.
There are ways that you can do it, like really slowly and
deliberately.
Yeah, and with short
intervals.
Short intervals with few steps in trot.
Yeah.
So let's look at that video.
See. So horse is stretching.
Now I'm standing. Yeah. Perhaps I have.
We'll see. Let's watch it through and then tell what we're looking at. What are we looking at?
I don't know. I don't remember. Yeah, there it is. Oh yeah. Now I'm trotting and standing in the stirrups.
And not holding on to the reins from what I can see.
No. And that's that's also good exercise, because many people actually do that, using the reins as a handhold. You can see that I'm actually moving better and better.
You actually move quite a lot through the hip joint. It's interesting to watch to me. I don't have much of a comment on it. You'll have to do your own comments.
I think it's just illustrating the things that we have said. All and right. I have also trouble with keeping my heels down because of this problem. And it's easier for me to keep a relaxed calf and a sort of moving ankle with a relaxed heel, not too much down, but like this. But you can see that my leg comes a little too much to the front.
Yeah.
That is because my hamstrings are not active enough.
Yeah. So you're, for all practical purposes, you are too strong on the front side compared to the back side.
Still.
So this is a thing you can find with some training programs and styles for training your body. You will find that someone will say that you are quad dominant. So the front side of your thigh is the dominant muscles in your movement patterns. I heard from a guy that I have come to respect quite a lot. He said that there is no such thing as being quad dominant. It just means your hamstring weak. Which is, I didn't like it much when I heard it first, but I've come to believe that is probably right.
Very true.
It is. You can never be too strong somewhere, but because we always want to get even stronger, right? There's always something to go for. You had some other trot things
I had.
too,
I'm a little confused now because I think I have a counter one, and that is 55-85. Let's look at that first, because I was a little confused.
Yeah, it's all right.
But let's see. And this is, I'm now trying to strike off into the counter while standing, and Dalton is a little like, what? And you can see there, I'm much worse at doing it when I'm cantering.
Yes. And that is because the movement is much more powerful in the canter.
Mm-hmm. So I get unstable.
Yeah, and then your body defaults straight into the quads again.
Yeah.
Because it's the only muscle that is strong enough to stabilize you in that much of a powerful movement.
So I need to work a lot with these exercises, and also especially the one where I'm pulling at my leg. I'm pulling my leg, pulling the leg upwards and then
stretching the front.
Stretching the front.
Which one is the?
I think perhaps
I want this one. Can I have that again? Sway back on horse.
55-77.
Yeah. Wasn't that
the one? Yeah, sit there.
Oh, that's just sitting still, is it?
Yeah.
All right. So the riding one where you do
the wobbly.
Okay, the wobbly 55-80. Sorry. All right. So I just wanted to clarify a few points or make a few extras. So for the horse to be able to move freely, your body has to allow that movement through itself somehow. The best way to do that is to get the movement through the hip joint. Mm-hmm. That is the ideal that we're searching for. Most people don't have hip joints that are both that flexible and that strong that they can do all sorts of exercises correctly through the hip joints. Sometimes I say that half jokingly that you need to be able to jump as far as the horse does stride to stride in order to be able to sit with the horse. Mm-hmm. So it's like you have to be as strong as the horse is, or except you're not 5, 6, 8, 900 kilos, of course, so that makes a difference. But I think you get my idea. But so we have this, there is an ideal. That's all right. We know that there's an ideal, and we shouldn't let ourselves be stopped by the ideal or feel that the ideal is overwhelming. This is important to me, for me to tell you guys. So we see that, I said it earlier, that Hannah moves kind of in this, when she tries really her best, she moves about 50-50 hip joints and lower back. And that isn't too bad. It's not bad at all, actually. But that's not the ideal. We are showing you that there are degrees to everything. And there are ways now to train so that you can become better. And that's what Hannah is showing. So when she stands up at the trot and moves through the hips at the trot, that will strengthen the ability to move through the hips in the right way. When she sits like this, when she moves her bum forward again, that will strengthen the ability to stabilize the spine. So all of those little things help you get closer to the ideal, which is the only thing we're searching for. What we are trying to explain is the road towards that ideal. I think we should all just be absolutely comfortable with not having reached that ideal yet.
Yeah.
And for me, it's a very important point for me and for quite a lot of people around, riders. I know that this is a difficult thing to handle. We aren't perfect, none of you, none of us, and that's all fine. So we are showing the way towards the ideal, always.
I was wondering, I think there is a full-size, that strange title of the video. Perhaps we can see that, because I think that one is something that I just have to see what it is, because I forgot the full size whatever the title of the video is called, something like that.
Yeah. Exciting.
It is sort of a surprise. No, is it just that one?
That's a title image.
Oh.
Or didn't you think about something else?
I've noted that there was a title of one of the videos as well, but that might be just my wrong. Because there is one video that isn't there, but that is okay. I think
the full size render one.
Yeah.
Yeah.
There. I think that is the one where I'm trotting, like sitting trot.
This is better. Why is this better?
Because I'm actually using my bum to move my hip joint.
Good job.
And then I'm trying to sit as still as I can. And now I was used to it, so I was thrown out of the saddle because I was concentrating more about the straightness or the stability of my core and not just pushing my hip joints. Here I'm pushing my hip joint a little more because, my body doesn't want to do it. So I have to forcibly push my hip joint up.
So if you leave your body to do its own thing, it's not going to happen.
No, it's not going to happen. It's just like the pictures of me standing, when you were taking my body and just forcing it to be straight.
Yeah.
Then it was really painful and really, really hard. Yeah, that one. That was so painful and I couldn't move at all. But that is what I have to do. But my body doesn't do it if I don't force it really forcibly.
Yeah.
So what I have and what I do when I'm teaching, I often I walk beside the horse, and I grab hold of the rider's thigh right under the hip joint and the knee, and I just push like that. In rhythm with the horse, and they're like, wow. And then they learn to use their seat muscles as well to move their hip joint.
Yeah. And
then after a while, normal people will start to move automatically in a better way.
Yeah.
And I am better than I was.
Definitely.
But, it takes a long time, and it takes a longer time. The older you get and the longer time you've done it wrong, it takes a very long time to get rid of it.
Yeah.
And I've been like this since I was a baby. So I got a neck injury when I was a baby.
Yep.
Before I learned to walk.
So in about 20 more years, we should be all right.
I trying to stay alive.
Let's go.
So, any questions? Quiet. All quiet from the West Front.
That's good.
Yeah.
Right. So we have been through where the hip joint is.
Mm-hmm.
We have been through how it looks when you stabilize and don't stabilize your upper body.
Mm-hmm.
So your spine and all. That is what we're trying to stabilize.
Mm-hmm.
We have been through how it looks when you're standing still, bending your spine or straightening your spine or relaxing, as it were.
Can we talk a little? There is one video we haven't seen.
All right.
It's about squatting. And squatting is a very, very good exercise for people who have all kinds of problems, actually.
Yeah.
When I am squatting, because we saw you squatting and jumping, but if we watch 4140, that is me, and it's Christmas. You see, it's very difficult for me, but I can do it, and I was really proud of myself there.
Yeah.
You can see it. I was smiling proudly.
Yeah.
Because it's so difficult to get down there with my feet forwards like that. Because in the squat there we saw the still picture.
Yeah.
My feet were more like outwards.
Yeah. So what we can see here is what I talked about with how the femur runs into the pelvis.
Yeah.
So at the bottom from about here, you can see the lower back is rounding a little bit. That is because the femur pushes the pelvis back.
Yeah. But
sometimes it is because the musculature isn't flexible enough. And then if you can't then accommodate that by way of becoming more not sway but the other way around, see slumped in your lower back.
Yeah.
If you can't do that, then you'll fall back.
Yeah.
But you're able to fold your lower spine, the lumbar spine, and make it so it's the opposite of sway back. And that was absolutely impossible for you before.
Because my neck has been better actually, so that my thoracic spine, the spine behind here.
Yeah.
It was very much like this, and now it's a little straightened out, and then it's much more, and it's possible for me to do the squat like that.
Yeah.
It's still very wobbly, and it's not perfect at all, but it's better. So it's all about trying to be a little better every day.
There is no such thing as a perfect squat.
No, and this is not something that you can sort of do this and then you're getting better. You have to just train a little each day. And squatting is and sitting in the paleo chair, like sitting down there in the picture number 3.
Sitting in a deep squat.
Because if you're sitting like that with your heels on the floor, and you can sit there. If you sit there for 10 minutes each day,
accumulated.
Yeah. If your legs start to sleep, then you have to get up and wake them up again, and then you try again.
Don't
and
do the typical horse person thing and just force your way through it.
Yes.
Yeah, they laugh.
Yeah. but many people, when you try this, they will fall on their backs.
Yeah, that's true.
But then you just grab onto a chair or a table, and you just hold on to that so that you don't fall backwards, and then and because this position is so good because it will stretch the part that needs to be stretched.
Yeah.
So start with this.
That's a great place to start. I think Mia has come across a question.
Yep. Hey. When working on your own, is there something that will help getting the movement or stability when you don't have someone on the ground to help you, or is it too individual to say something in general?
when you're riding? Yeah. Yes, there are several things. Let me see. I want you to point out, let's say, 3 main things. 1, always correct your pelvis by way of putting your legs up on the knee pads and pull your bum forward and find the deepest point in the saddle. You're supposed to have your seat bones in the deepest point of the saddle. Always do this. Number 2, always stretch the front of your thighs and or the inside of your thighs before you ride or during your ride. Number 3, get a lifting belt, like one of those belts that they sell, the Better Bodies or whatever they're called. No, we're not sponsored. Any lifting belt like that, and put it on so you can push your midsection out into the belt while you ride. If you do these things, you will be a better rider every day, and that will improve your horse, and then that goes on and on.
And I've got another exercise that is possible
Good.
to do. It's if you do this, the 2-point seat that is standing in the stirrup, as I did in one of the videos, and you try to sit slowly down, like really slow, so that you can feel the horse's movement and how the saddle is moving.
So you stand, leaning
and
forward
then
while
you sort of-
walking?
While walking or trotting or
trotting.
cantering.
Oh, wow, yeah.
Yeah. Because
But
then
it's scalable, so it's more and more difficult.
Yeah, but then if you do that, you will, when you're standing in the stirrups, is more or less like a squat.
Yeah.
So it's sort of calibrating your body, because you can't do it if you're not doing it more or less perfectly or good, because then you will fall off. You will lose balance.
Yeah.
So when you're standing there and you sort of you can sort of do this with your whole body, and your knees and your hips and your ankles are cushioning the movement, then you're starting to lower yourself into the saddle, and then you feel the movement of the saddle. And in the walk it will be like this, in trot it's like this, and in canter is like this. But you can feel the bum if you sort of think that you're sort of hovering like 1 millimeter over the
so just
over
the
the
skin
saddle.
touching, not squeezing your muscle flat.
And that is a very good exercise for getting the right movement, and also feeling how the horse is actually moving the saddle.
Yeah.
So if you do that, it's a way to teach your nervous system and not your brain, your conscious brain, to do it, because the conscious brain is just
Useless at moving.
Yeah, it's just destroying everything. So and I find that this exercise is very good for the students.
So at least 4 exercises there. Cool.
And we'll get back to more exercises. I think next time we're doing some horse stuff again, but just to look at our youngsters and stuff, because you need to have some variation, I think, and we need it as well.
We need it for sure.
But we're getting back to exercises in the training room, exercises on horseback, and daily things that you can do in the living room while you're watching TV.
Yeah.
Things like that.
So some of us, we are going to try and start doing some jumping exercises to get more explosive in our movements. Some will be working more on flexibility.
Yeah.
Some will keep plugging away on strength.
Yeah.
And we will show you all of it as soon as we get there.
And we're going to have many different kinds of riders, not just handicapped ones. So yeah.
Alrighty then.
Yeah.
I think that more or less sums up our evening. Thank you guys for tagging along. This has been a short excerpt about the lower back and how to stabilize it and why it links into the movement in your hips. So we will be back in a couple of weeks. Hopefully then with some fresh imagery of our youngsters, hopefully. and we'll see how they are coming along. Thank you guys for tagging along with us. Good night.
Bye.